Erectile dysfunction is the inability of a man to obtain an adequate erection for satisfactory sexual intercourse. Erectile dysfunction is extremely common and is estimated to affect at least 40% of men by age 40. There are several causes of erectile dysfunction. Most commonly, it's a blood flow issue where there's inadequate blood flow to the penis to sustain a rigid or maintain a rigid erection. It also can be caused by nerve damage and also hormonal issues, including low testosterone. Erectile dysfunction is most commonly a subjective diagnosis. In other words, it is diagnosed by the patient's complaints about their sexual function not being adequate for their satisfaction. Erectile dysfunction is preventable to some degree by optimizing your health and limiting your risk factors, primarily those risk factors that deal with poor blood flow, such as controlling weight, exercise, preventing diabetes, and other health problems that could affect blood flow. The benefits of seeing a specialist for erectile dysfunction is that we have the most vast experience and offer the most cutting-edge treatments for sexual dysfunction. The most common treatment option for erectile dysfunction is oral medications, which most patients are quite familiar with. Beyond oral medications, there are different ways to deliver medications to the penis, such as injection therapy. There are also vacuum devices and also surgical therapies such as penile implants. We determine the most appropriate treatment generally by trying the least invasive, least aggressive treatment first and then determining the response. We also work patients up by evaluating them with a physical exam, blood work, and an extensive history. Different erectile dysfunction treatments have different satisfaction rates. Certainly pills, which are most commonly provided to patients, work in a good percentage of time, but not for all patients. Injection therapy has a higher satisfaction rate, though sometimes causes some discomfort. Vacuum devices have intermediate satisfaction rates depending on patients' expectations. And penile implant surgery, although a surgical procedure, has some of the highest satisfaction rates of any therapies available. Some of the long-term consequences of not having erections focus on the psychosocial aspect of a man's health, such as their confidence, their happiness, and their well-being. But also, not having erections for a long period of time can affect the elasticity of the tissue and can cause some shortening of the penis.